report suggests that widespread fraud has taken root in the state of Minnesota. Prosecutors say that industrial-scale fraud has affected at least 14 federally funded programs in the state. And since 2018, $9 billion or more may have been stolen from these programs, stolen from taxpayers and from the people in need that these programs are meant to help. There have been nearly 8 indictments related to just one organization that received $250 million by claiming to have served meals to needy people during the pandemic. In another case, prosecutors say that a program designed to help people at risk of homelessness was subject to widespread fraud, with its cost ballooning to more than $100 million in just 4 years. In yet another case, prosecutors state that a fraudulent provider stole $14 million from a program to provide therapy to children with autism. And I could go on. Mr. President, one has to wonder how this could happen, and I hope we will soon find out. Last week, every Republican senator joined Senator Cassidy's letter to the governor of Minnesota demanding answers about the large-scale fraud that appears to have happened on his watch. The Department of Justice has surged resources to Minnesota to assist in prosecuting these crimes. And the Trump administration recently announced it is creating a new position in the Department of Justice focused on investigating instances of fraud across the country. Because unfortunately, Mr. President, cases of waste, fraud, and abuse are not confined to one state. The Government Accountability Office estimates that as much as $500 billion in federal funds is lost each year to fraud. Not an inconsequential sum, Mr. President. And every one of those dollars is a dollar that isn't going to an American in need. Mr. President, Republicans have been working to root out waste, fraud, and abuse in federal programs. The same type of abuse is now coming to light in Minnesota. Our landmark legislation, the Working Families Tax Cuts, included a number of reforms to focus federal dollars on those most in need, guard against abuse of taxpayer funds, and hold states accountable for the federal funding that they receive. New measures in the law prevent non-citizens from receiving federal health care and nutrition benefits and refocus those programs to serving American citizens. The law also strengthens work requirements for able-bodied working-age adults without young children, and it increases accountability. The new law requires states to check eligibility for certain Medicaid enrollees twice per year and to remove ineligible people from their Medicaid rolls more quickly. It takes aim at duplicative enrollment in federal health care programs, which CMS estimates is costing taxpayers as much as $14 billion per year. And it ensures deceased individuals don't continue receiving payments from Medicaid, as happened in Colorado a few years ago, costing taxpayers more than $7 million. Mr. President, we also took steps to hold states accountable for being good stewards of federal funding. We're incentivizing states to reduce their error rates when making SNAP payments. And significantly, we took aim at rampant abuse of the provider tax loophole. Use of this loophole, which sees states inflate the price of health care services provided through Medicaid in order to garner larger reimbursement from the federal government, has been a problem for quite a while now. And thanks to waivers that the Biden administration issued to California and other blue states, allowing them to further exploit a similar loophole, taxpayers were on the hook for tens of billions of dollars in new spending. So Republicans took action to rein in this abuse and reduce the bills that states are running up for taxpayers. Mr. President, ensuring that federal taxpayer dollars are being spent responsibly and effectively on the people they are supposed to help ought to be a no-brainer. And it should not be a partisan issue. But apparently it is. While Republicans were working to restore integrity to federal programs, Democrats were panning our common sense measures as, quote, cruel, and then voted again and again to repeal them. We've heard little from Democrats condemning the fraud scandal currently engulfing the state of Minnesota. And Democrats have shown that they are perfectly willing to allow waste, fraud, and abuse to continue in the Affordable Care Act exchanges. That's right. Despite evidence of fraud in the ACA exchanges, Democrats have voted time and again to do nothing about it, and have actually tried to repeal Republican-led reforms. Mr. President, there is waste, fraud, and abuse in Obamacare. And it seems that the Biden COVID subsidies were especially susceptible to fraud. A recent report from the Government Accountability Office revealed that the ACA exchanges continue to enroll fake individuals, improperly pay out taxpayer-subsidized health insurance, and fail to ensure payment accuracy. The GAO tested 24 fake accounts on the ACA exchanges. 23 of them were enrolled with false or no documentation to verify Social Security numbers, citizenship, or reported income. And then there's the growing number of enrollees in the exchanges who filed zero claims. In 2024, 40% of people who got fully subsidized insurance coverage through the exchanges never filed a claim. 40%. Now, there might be some good reasons for that, but it might also be because insurance companies are incentivized to sign people up, and these individuals may be signed up and not even know that they have coverage. The Democrats have shown they are perfectly fine with the status quo. They voted numerous times to extend the enhanced subsidies without a single reform. They even shut down the government to try and extend them. These are just the beginning of the issues with Obamacare. Mr. President, work continues to investigate and prosecute criminals engaged in fraud and to hopefully recover the tax dollars that have been stolen. And I certainly hope the individuals in Minnesota and other criminals around the country are prosecuted to the full extent of the law. But we can't just hope to prosecute fraud. We need to prevent it. We need to be responsible stewards of taxpayer dollars and place guardrails on federal programs to protect against nefarious schemes and bad actors. We need to ensure that when we commit taxpayer dollars to a particular program, that money actually goes to the people that program is designed to help. Republicans have made progress on restoring integrity to federal programs this past year, but we have more work to do. And we'll continue our efforts to be good stewards of taxpayer dollars and ensure that federal programs are serving the American people as intended. Mr. President, I yield the floor, and I suggest the absence of a quorum.
The clerk will call the roll.
Ms. Alsobrooks.
I recognize the Majority Whip.
Mr. President, I ask unanimous consent that the quorum call be vitiated.
Without objection.
Mr. President, when government wastes taxpayer money, taxpayers have a right to know what happened. And when emboldened criminals steal money intended to help single moms and children in need, taxpayers have a right to be angry. And Americans, and I'm hearing it in Wyoming, and I'm sure you're hearing it, Mr. President, your home state of Ohio, Americans are infuriated with the staggering amount of fraud unfolding today in the state of Minnesota. The past few weeks have shown just how deep the corruption in Minnesota has turned out to be. Investigators have now uncovered fraud schemes across 14 different Minnesota Medicaid programs. Most people don't even know there are 14 different Medicaid programs. There's fraud in all of them in Minnesota. Joe Thompson, who's U.S. Attorney in Minnesota, has spent his career prosecuting fraud. And based on his extensive investigation, he believes criminals have now stolen at least $9 billion with a B dollars from those Minnesota Medicaid programs. That is half of the total amount of money Minnesota spends for Medicaid programs in the state. Today, the fraud is so prevalent that Thompson says the state has developed a fraud tourism industry. Can you imagine that? A fraud tourism industry. Here's how these schemes work. Criminals, fraudsters, set up fake businesses for nonprofit organizations. The criminals then claim to provide services such as housing, food, and health care assistance. Then they bill Medicaid. And they bill them for services never provided. They use the names of children and enroll them into the programs. Sometimes the children don't exist, sometimes the children exist, and they're signed up by parents who are getting paid fraudulently to let them use their children's names. In 2021, taxpayers paid $4.6 million for something called Minnesota's Integrated Community Support Medicaid Program. It's a mouthful. 2021, $4.6 million. Then the fraudsters hit. 3 years later, due to criminal fraud, spending for that program ballooned to more than $170 million. From $4 million to $170 million, that's 37 times as much in just 3 years. Money completely stolen. As the governor and others in Minnesota, the Democrat elected officials looked the other way. Taxpayers similarly paid $21 million in 2021 for something called Minnesota's Housing Stabilization Services. The first 6 months of last year, due to criminal fraud, Democrats looking the other way, taxpayers paid nearly 3 times that amount. A Medicaid program claiming to help Minnesota children with autism, $6 million in 2018. By 2023, due to criminal fraud, it went from $6 million to $192 million. And daycare fraud is just one of these brazen schemes where the Democrats in Minnesota look the other way. Last month, an independent journalist visited 10 state-funded daycare sites in the Twin Cities of Minneapolis, St. Paul. He found no children at the daycare centers. Middle of the day, not a single child was there. 1 year ago, a local reporter visited several of those same sites. The reporter found no children at the daycare centers. They're supposed to be daycare centers, and they're getting paid to take care of children. Well, here's one of those sites, Mr. President. This is a sign from one of the states. It's called, who makes this? You can't make this stuff up. Quality Learning Center. It's supposed to be a learning center. They can't even spell learning right. But that doesn't stop the Democrats in Minnesota to keep shoveling money right to these programs, stealing money from the taxpayers, from the Democrats, going to Democrats who are running these things. Mr. President, it's appalling. The people of the United States are appalled and are furious. This ought to be a red flag for fraud. Why aren't the Democrats who run the place doing anything about it? There were 95 violations for this Learning Center alone between 2019 and 2023. Violations occurred, no records on the children. But in Minnesota, run by the Democrats, taxpayer money continued to flow. It's disgraceful, Mr. President. These aren't just one-off abuses. We now know that the fraud schemes used in the state's child care programs have been used to defraud other social programs as well. Even the New York Times has pointed to this. They say the fraud in Minnesota, run by the Democrats, is, quote, staggering in its scale and brazenness. I don't see any Democrats coming to the floor here today to point out the fraud, talk about what's happening there, how the money's been stolen from people that need it, the services that are needed by people. That means they're not getting it. The Department of Justice has charged 98 defendants in Minnesota Medicaid fraud-related cases. So far, 64 of these have been convicted. Last month, one defendant was found guilty of stealing $14 million from Medicaid. Yes, she did. She stole $14 million from Medicaid. You don't hear a word from the Minnesota Democrats coming to the floor here to talk about it. Nope. She also stole nearly $500,000 from child nutrition programs. You hear the Democrats coming to the floor and say, oh, we need more money for child nutrition, more money for child health care. Why aren't they looking at where the money is being taken from the mouths of the children for fraudsters? What was done? How much money was taken? Let's put this into perspective. The stolen money was supposed to be used to provide 200,000 meals for hungry children who did not get fed. Democrats must think that's fine. The defendant instead sent the hundreds of thousands of dollars overseas, and she bought real estate in Kenya, in Africa. Apparently that's how business goes in Minnesota with the Democrats who are running that state. This organized systemic theft has gone on for years under Democrat leadership, and it really exploded under Joe Biden, Kamala Harris, and Minnesota Governor Tim Walz. The Democrats have permitted schemes stacked upon schemes to drain money meant for those in need. Republicans are not going to allow this massive theft of taxpayer dollars to be ignored. Democrats want us to just look the other way. We are talking about a comprehensive approach to root out the fraud in Minnesota and across the country. Now, our Working Families Tax Cut law fights fraud. We strengthened eligibility requirements for Medicaid. We ensured that illegal immigrants don't receive taxpayer-funded health care. We put in place work requirements for Medicaid and for food stamps. These policies will protect taxpayers and will increase accountability. Additionally, Republicans are conducting aggressive congressional oversight. On Friday, the entire Senate Republican conference demanded Governor Walz explain his actions. We asked 9 specific, detailed questions. Questions such as why Minnesota failed to adopt key fraud prevention measures. Why aren't they trying to prevent the fraud? Why do they keep looking the other way? These are measures that the Department of Health and Human Services recommended to Minnesota back in May. Nope, Governor Walz, nothing to do with it. He knew about this widespread fraud. He refused to do anything about it. Senate Republicans are ready to give the Trump administration the manpower it needs to tackle this fraud in Minnesota and wherever else it appears and occurs. Now, the Trump administration has asked the Senate to confirm a new Assistant Attorney General position, a position that will be focused on the fraud. And the Senate will get that person in place and on the job quickly, Mr. President. The Trump administration has taken other bold and decisive actions to stop fraud. To further strengthen enforcement efforts, the Department of Justice has doubled the number of attorneys handling these fraud cases. The Treasury Department is cracking down on businesses in Minnesota for alleged money laundering, because that's what's happening. The Department of Health and Human Services under President Trump froze federal funding for fraud-prone programs in Minnesota. If Senate Democrats cared about stopping fraud, why are they preparing to vote today to loosen eligibility and income verifications for Obamacare subsidies? They ought to want to be tightening these things up. But that's what the Congressional Review Act resolution from Democrat Senator Mark Warner of Virginia does, and we're going to vote on it today. Eliminating these vital protections invites more fraud. It means subsidies go to individuals who don't qualify for them. Congress shouldn't make it easier to defraud the American taxpayers. This is a wrong direction to take after the biggest fraud scandal in Minnesota history. Protecting taxpayer dollars should not be a partisan issue. The fraud scandal in Minnesota should be a wake-up call for every American taxpayer. Our federal government spends nearly $1.5 trillion each and every year to try to help feed and house and treat and care for vulnerable families and children. Those programs are there for a reason. The Democrats seem to be a piggy bank for people who want to steal from the government. Medicaid, food stamps, and other social programs have been called a lifeline. Years of waste, fraud, abuse, and corruption have pushed those who truly need the help away from the lifeline and to the back of the line. That's what Democrats have been enabling and continue to enable. Republicans aren't going to stop until the depth of this fraud is uncovered and prosecuted. And Republicans are committed to preventing it from happening again. Thank you, Mr. President. I yield the floor.
I want to say that the senator from Minnesota has been relentless in terms of standing up for folks who are just trying to get a fair shake on their premiums. I've been doing this since my days with the Gray Panthers, and I know what it means to be persistent. That defines Senator Klobuchar, and I thank her. I'm pleased to be working with Senator Warner and Senator Ossoff. I see Senator Kaine here, because all of us want to make sure we lower health care costs for American families. Today, the Senate's going to vote to repeal a host of damaging policies that Donald Trump, Robert Kennedy, and Dr. Oz have unleashed on Americans who are unsuspecting. People who are just trying to get by in tough times are going to get hammered. And from the day Donald Trump was sworn in, this administration made attacking Americans' health care their top priority. Last summer, Republicans in Congress rammed through a massive bill to give tax breaks to billionaires and giant corporations while making the largest health care cuts in American history. At the same time, the Trump administration used the Byzantine federal rulemaking process to double down on these efforts by finalizing the rule that all of us on this side of the aisle are working to repeal today. The harmful changes made by the Trump administration come down to one proposition. It's okay to have more red tape, and it's just fine to increase health care costs. That's the exact opposite of our agenda, which is to focus on affordability and making the American health care system simpler. I'm going to just tick through a couple of the worst examples to illustrate why these rules need to be junked. First, the Trump rules will increase what American families have to pay out of pocket each year by nearly $1,000. So the question becomes, Mr. President, what's the purpose behind that change other than to take money from Americans who are already struggling? The rule adds new fees, such as the new re-enrollment fee that applies to low-income workers. To be clear, that means if you want to keep your health insurance, you got to pay a fee to the government just for the right to keep what you've got. Even by Washington, D.C. standards, I say to my friend from Montana, that just defies common sense. They also create mandatory minimum premiums that are going to cause millions to lose their coverage. Now, Republicans say that these fees are aimed at reducing fraud. There's just no evidence to back it up. My view has been, ever since my days with the Gray Panthers, and my friend from Virginia knows about this, I say any fraud is too much. But the numbers are clear. The vast majority of fraud in health care is conducted by shady insurance brokers who are looking to make a fast buck through commissions from phony enrollments, not working Americans looking to buy health care. So I've introduced legislation to create tough criminal penalties for these insurance brokers. So make no mistake about it, Senator Kaine, there's something we ought to be doing to root out fraud. Let's go after these insurance brokers with tough criminal penalties. I've been talking to Republicans to ask them to join as co-sponsors, and they haven't been willing really to give us the time of day. Instead of going after fraud where it exists, Donald Trump and Republicans create barriers that are going to trip up Americans trying to navigate a health care system that's just too complicated. Beyond fees and higher premiums, the Trump rule also adds new verification checks and enrollment rules that amount to an enormous heap of red tape. These red tape measures, according to authorities who've analyzed it, is going to create 15 million hours of paperwork. 1.8 million people are going to lose their coverage as they try to navigate this never land of a maze of health care rules. These types of changes are right out of the playbook of big insurance because they create barriers and bureaucratic hurdles so they keep more of your money while denying working families basic health care. It's no secret that Americans have had a belly full of a health care system that gets in their way at every turn. It's time for Republicans to do the right thing and join with Democrats to lower Americans' health care costs instead of creating new cost barriers and red tape restrictions. They can help those families by voting with us today. I urge my colleagues to support Senator Warner, and Senator Ossoff, Senator Klobuchar, Senator Kaine, we're all here for one purpose: less bureaucracy, less red tape, lowering premiums for families. I yield the floor.
Mr. President, I ask unanimous consent to be able to complete my remarks before the scheduled recess.
Without objection.
Thank you. Well, I rise today because this president is poised to strip away health care from American families again. If Congress doesn't act to pass this measure, Americans will be forced to jump through more hoops just to get health insurance, and 1.8 million Americans will lose their coverage. This is just more of the same from Republicans and the president. Donald Trump and Republicans have spent over a decade trying to repeal the Affordable Care Act entirely, with no plan to replace it. When they haven't been able to repeal it wholesale, Republicans have looked for ways to attack and weaken the Affordable Care Act from the inside out. And this is just what the administration did with this rule. They are chipping away at the Affordable Care Act and taking away health care from Wisconsin families. While President Trump works out his concept of a plan, Republicans still have no real proposal on health care. Even if they could repeal the Affordable Care Act, they have nothing to protect the 24 million Americans who got coverage on healthcare.gov from being simply kicked off their insurance. Concepts of a plan simply are not good enough for the people that I represent. They deserve better. In fact, they need some breathing room and lower costs. Instead of meeting families where they are and lowering costs, Republicans are taking us in the wrong direction. At the start of this year, 22 million Americans saw their premiums go up in 2026 because Republicans refused to extend tax breaks to help families afford their health care. And behind every one of those 22 million Americans is a story: a family forced to make impossible choices about finances, their health, and their future. I'm talking about folks like Nancy and John from Park Falls, Wisconsin, whose premiums were set to increase by over $2,000 each month in 2026. Nancy wrote to me, "This is absolutely unaffordable. Literally, we cannot pay this. We would have to sell our home and our vehicles in order to just come up with the money to do that." Another constituent from Barron County, Wisconsin, wrote to me sharing that without the tax breaks, he would have to spend over 40%, get that, 40% of his income on health insurance alone just to ensure his wife could continue to get her treatment for her breast cancer. I also heard from Eric and his wife in Menominee, Wisconsin. They both retired from teaching after 30 years and are still not yet eligible for Medicare. He wrote to me that they were seriously considering going without any health insurance, since paying close to $3,000 a month on a fixed income might just break the bank. Republicans ran out the clock on helping families like these, and the final window to get coverage for this year ends in just 2 days, on January 15th. How many Americans like Eric or Nancy are being forced to give up their health insurance this year? And how many more will consider selling their houses or their car just to make sure that they can afford sometimes life-saving care? And now, on top of this, the Trump administration is pushing a rule to kick even more families off of their health care. The rule we're talking about today would shorten the open enrollment periods and introduce much more red tape, locking eligible families out of getting their health insurance. We should be making it easier, not harder, for Americans to see a doctor. We should be making health care more affordable, not more expensive. Over the past year, I've talked to countless constituents who are sick and tired of Republicans' constant attacks on their health care. Instead of spending time coming up with new ways to kick Americans off Affordable Care Act plans, I urge my Republican colleagues to help us reverse this disastrous rule and actually start working with us to fix our broken healthcare system. I yield.